Hi, my name is Dr. Tina Ho. I am a double board certified facial plastic surgeon based in Philadelphia. This is an educational webinar featuring deep neck lift surgery. Traditional techniques focus mainly on removing excess skin as well as addressing the lower muscle layer. An ideal candidate for deep neck lift surgery is someone who feels that they have lack of jawline and neck contour in this area. It can be a young patient who feels that based on congenital issues that they have a lot of fullness here and they desire to reduce this area. In an older patient, this can be a patient who's noticed with time more fullness of the tissues here as well as skin laxity. Overall, these patients wish that they had a more crisp neck angle and more jawline and neck contour. My structural approach to neck lift surgery involves sculpting of the deeper structures to restore more definition to the jawline and the neck. For my younger patients, they often demonstrate good skin tone, so we don't necessarily need to remove skin. I typically make an incision underneath the chin. After that, I then lift the skin and then get down to the muscle layer. I'll then enter the muscle layer and take a look at the deeper structures to see what needs to be sculpted. This can be deeper muscle, fat, and glands that I will then remove down to the level of the jawbone to get that improved jawline contour result. And then bring back the muscle layer, I sew it up at midline, and then I close the incisions. For a patient who also has skin laxity as well, I will include additional incisions behind the ear so that we can be able to remove skin as well as also tighten the muscle layer out laterally through this approach. Recovery varies by patient in terms of degree of discomfort, swelling, bruising, other factors associated with healing. Patients see myself and no other providers at every single visit. I do tell patients that the worst of the bruising and swelling will peak at about 48 hours out and then start to subside over the next couple weeks. The patients will be icing the first couple of days, starting to work on wound care. They typically have a neck drain in place that stays there for up to a week out from surgery. We have a lot of tools in our post-operative plan to help patients have minimal downtime and to accelerate their healing. One tool is Elixir MD, a photomodulation device that helps to reduce swelling, bruising, also lymphatic drainage to really accelerate the healing process. This device is used to provide treatments for surgical patients every couple of days for that first week or so out from surgery. About a week out, I tell my patients it's a good turning point where we take out the sutures, we remove the neck drain by then, and then at 2 weeks out, they can start to resume some exercise, some more normal activity. More than a month out, patients will feel more socially presentable, that they feel more comfortable to attend an event like a wedding or go out to dinner with friends. And then final results are typically seen at 6 to 12 months out. Deep neck lift surgery is a very definitive procedure and patients can see results that can last as long as 10, 15, 20 years. Thank you so much for taking the time to watch my webinar on deep neck lift surgery. Please reach out to our team with any questions. I look forward to meeting you in consultation and to helping you achieve your neck rejuvenation results.